the overwhelming majority of men are unaware of the true impact of sodium bicarbonate on their health. Have you ever considered that a common ingredient in your kitchen, that white powder used in baking and cleaning, might be intrinsically linked to your energy, vitality, and even longevity? The surprising truth, ignored by over 97% of the population, is that bicarbonate, when applied correctly, produces remarkable effects on men's health, especially for gentlemen over 65 who struggle with erectile dysfunction, decreased libido, and prostate problems. A recent study from the University of São Paulo indicates that imbalances in body pH exacerbate inflammations that affect sexual health, and bicarbonate emerges as an unexpected ally. However, there are secrets that the pharmaceutical industry prefers to keep hidden. Follow me, because today, I will unveil how this simple compound can transform your life. My name is Dr. Alberto Rossi, and for over 45 years, I have helped men regain sexual health and vitality as a urologist and specialist in men's well-being. I have helped thousands of patients overcome challenges similar to yours, and I am here to guide you with science, experience, and proven practical solutions. Let's get to the crucial point. After 65, many men notice a significant reduction in energy. Erections become more challenging, sexual desire diminishes, and frequent nighttime bathroom visits become routine. These symptoms are not just normal consequences of aging. They can point to serious problems, such as poor blood circulation, chronic inflammation, or hormonal imbalances that affect everything from the prostate to the cardiovascular system. According to the Brazilian Society of Urology, more than 55% of men over 65 suffer from erectile dysfunction, and about 75% present some degree of benign prostatic hyperplasia. But the little-known connection is this: excessive body acidity, derived from dietary habits, stress, or medications, can aggravate these conditions, inflaming tissues and compromising circulation. Sodium bicarbonate comes into play as a natural acid neutralizer. Initial studies, such as one from 2024 from the State University of Campinas, suggest that bicarbonate, in controlled doses, can help balance body pH, reducing inflammation that affects cardiovascular and prostate health. The importance of this lies in the fact that chronic inflammation is a trigger for problems such as erectile dysfunction and heart disease, which, according to the Journal of Sexual Medicine 2025, increases the risk of fatal events by 30% in men with sexual problems. Ignoring these signs can transform your years of experience into an arduous struggle against diseases. Allow me to share the story of Joe, a 68-year-old patient from Porto Alegre. He sought me out complaining of fatigue, difficulty maintaining erections, and frequent trips to the bathroom. Joe considered these symptoms inherent to age and was about to give up his sex life. After examinations, we detected an enlarged prostate and signs of generalized inflammation, exacerbated by a diet rich in acidic foods, such as processed meats and soft drinks. We introduced dietary modifications, and, under my supervision, he began using sodium bicarbonate diluted in water, in safe doses, to balance his pH. In 4 months, Joe reported more energy and a significant improvement in erectile function. Dr. Rossi, I never imagined that something so simple would make such a difference, he exclaimed. Another case is that of Carlos, 70, from Manaus. Carlos suffered from low libido and high blood pressure, which further compromised his sexual health. In addition to adjusting his diet and recommending physical exercise, I suggested the controlled use of bicarbonate to reduce body acidity, which was contributing to inflammation. Together with other healthy habits, Carlos regained self-confidence and intimacy with his wife. These examples demonstrate a truth that most ignore. Bicarbonate, when used with medical guidance, can be a powerful ally for sexual and overall health. However, it is important to emphasize that bicarbonate is not a miracle solution. Its improper use can result in problems, such as electrolyte imbalances, especially for those with hypertension or who are taking medications. Next, I will show how to incorporate bicarbonate safely, along with other natural strategies that the pharmaceutical industry prefers to omit. Are you ready to regain your vitality and prolong your quality of life? Now that you understand how sodium bicarbonate can be an unexpected ally in combating erectile dysfunction, low libido, and prostate problems, it's time to delve deeper into the subject. I am Dr. Alberto Rossi, with over 45 years of experience helping men regain vitality. And today I will reveal why 97% of people ignore the potential of this accessible ingredient, and how to use it safely to significantly improve your health. We will explore the sexual challenges after 65, how bicarbonate integrates into this issue, and take the first practical steps for you to start today, ready to change your life. First, let's understand what's happening in your body. After 65, men's sexual health is affected by three major villains: chronic inflammation, poor circulation, and hormonal imbalances. Inflammation, often caused by a diet rich in acids, such as fast food, soft drinks, and excessive red meat, damages blood vessels and the prostate. A 2025 study from the University of São Paulo showed that men with imbalanced body pH 25% more likely to develop prostate symptoms, such as difficulty urinating. Poor circulation, in turn, reduces the blood flow necessary for firm erections. According to the Brazilian Society of Cardiology, 65% of men with erectile dysfunction exhibit signs of atherosclerosis, the accumulation of plaque in the arteries, and testosterone. Reduced levels, common after 65, are aggravated by stress, sedentary lifestyle, and even systemic inflammation. Sodium bicarbonate acts as an acid neutralizer, contributing to the reduction of inflammation that aggravates these problems. A preliminary 2024 study from the State University of Campinas indicated that controlled doses of bicarbonate can decrease inflammatory markers by up to 20% in men over 65, improving cardiovascular and prostate health. But why do so few people know this? Because the pharmaceutical industry makes greater profits with medications like Viagra or invasive treatments. Don't get me wrong, sildenafil, the active ingredient in Viagra, can help, but it only treats the symptom. In 2024, ANVISA warned about side effects such as dizziness and headache in 12% of users, especially those with hypertension. My patients frequently report feeling dependent on these medications, and I want to show you that there is an alternative path. So, how to start using bicarbonate in a practical and safe way. Here is the first application. Based on my 45 years of experience as a urologist, you can try a simple solution. Mix half a teaspoon of sodium bicarbonate in a glass with 250 milliliters of water and drink once a day, preferably in the morning on an empty stomach. Do this for a maximum of 7 consecutive days, then take a week off. This helps balance the pH without overloading the body. But be careful. Never use bicarbonate without consulting your doctor, especially if you have hypertension, kidney problems, or take medications such as antihypertensives. One of my patients, Pedro, 66, from Curitiba, started this protocol under my supervision and in 1 month noticed less fatigue and an improvement in disposition, which was reflected in his intimate life. In addition to bicarbonate, diet is fundamental. Reduce the consumption of acidic foods, such as fried foods and soft drinks, and include alkalizing options, such as avocado, kale, and melon. A 2025 study from the Nutrition Journal showed that men with diets rich in leafy vegetables improved erectile function by 22% in 12 weeks. For the prostate, lycopene present in tomatoes and guavas is essential. A daily salad with tomato, olive oil, and basil is simple and effective. And don't forget Brazil nuts. 2 a day provide selenium, which, according to the Federal University of Para, Arling Arwu, increases testosterone by 18% in 2 months. Physical activity is also your ally. 40-minute walks, 5 times a week, improve circulation, and reduce the risk of erectile dysfunction by 35%, according to the British Journal of Sports Medicine 2025. For the prostate, practice Kegel exercises. Contract the pelvic muscles for 7 seconds. Relax, and repeat 12 times, 3 times a day. A patient, Ricardo Lucici, from Brasilia, incorporated Kegel exercises into his routine and, in 2 months, reduced his nighttime bathroom visits. He told me, "Dr. Rossi, I feel like I've regained control of my body." I'd like to mention another Brazilian plant that complements the use of bicarbonate, Pharma, approved by Anvisa, known as the Amazonian Viagra. It stimulates libido and circulation. A 2024 study from the Federal University of Amazonas showed that men over 65 who used Pharma for 90 days reported a 25% improvement in sexual function. But, as with bicarbonate, consult your doctor before using, especially if you have chronic conditions. Nature is powerful, but it requires responsibility. Share your experience in the comments. What is the biggest obstacle you face in your sexual health? Lack of energy, problems with erections, prostate symptoms. Your contribution will help other men, and I read all the comments to create more relevant content for you. Subscribe to the channel and activate the bell so you don't miss the next tips. Before concluding, an extra tip: observe your urine. If it is very dark or you feel burning, it may be a sign of inflammation or infection. Note these symptoms and see your doctor. Next, I will present a complete 45-day plan with real examples of men who transformed their lives and show how to overcome barriers such as shame and lack of motivation. Are you ready for the next step? Welcome to the final stage, where you will receive a complete 45-day plan to transform your sexual health and protect your longevity using the power of sodium bicarbonate and other natural strategies. I am Dr. Alberto Rossi, with over 45 years of experience helping men regain vitality. And now is the time to put into practice everything you have learned. You already know that erectile dysfunction, low libido, and prostate problems can be signs of inflammation and imbalances that bicarbonate can help combat. In this segment, I will detail how to apply these solutions, share real stories of men who have overcome these challenges, and help you overcome barriers such as shame or lack of motivation. Together, shall we build a life full of energy? First, the 45-day plan. Start with your diet, which is the basis of everything. Incorporate 3 alkalizing foods daily. Avocado, to improve circulation with its healthy fats. Kale, rich in antioxidants that protect the prostate. And melon, which hydrates and reduces acidity. A 2025 study from the Federal University of Rio de Janeiro showed that men with alkaline diets had 20% fewer prostate symptoms in 3 months. My suggestion: have breakfast with mashed avocado on whole wheat bread, lunch with sautéed kale, and melon for dessert. For testosterone, eat 2 Brazil nuts a day. The Federal University of Para, Arling Arwu, confirmed that selenium increases hormonal levels by 20% in 60 days. Now, sodium bicarbonate. Use it cautiously. Mix half a teaspoon in 250 milliliters of water and drink in the morning on an empty stomach for 7 consecutive days. Then, take a week off and repeat the cycle for 45 days. A 2024 study from the State University of Campinas showed that this dose reduces inflammatory markers by 20%, which can alleviate prostate symptoms and improve circulation. But I repeat, consult your doctor beforehand, especially if you have hypertension, kidney problems, or take medications. One of my patients, Jose Luchaba, from Florianopolis, followed this protocol under my supervision and, in 1 month, reported less fatigue and more consistent erections. He told me, "Dr. Rossi, I didn't imagine that something so simple would make such a difference." Physical exercise is the next pillar. Walk 40 minutes a day, 5 times a week, to improve circulation. A study by the British Journal of Sports Medicine 2025 showed that this reduces the risk of erectile dysfunction by 35%. To make the activity more enjoyable, walk in a park or on the beach and practice Kegel exercises. Contract the pelvic muscles for 7 seconds, relax, and repeat 12 times, 3 times a day. My patient, Antonio, 70, from Rossi did Kegels while watching TV and, in 2 months, reduced his nighttime bathroom visits from 4 to 1. He told me, "Dr. Rossi, I feel like I've regained my freedom. Sleep is essential. Men over 65 need 7 to 8 hours of restorative sleep. Sleep deprivation increases stress and reduces testosterone, worsening libido." A 2024 study from Unicamp showed that men with poor sleep have 25% more sexual problems. My tip: avoid screens 1 hour before bed and drink chamomile tea. And if you have a partner, talk about your needs. Emotional connection reduces pressure and strengthens intimacy. Regarding supplements, see this Bicarbonate, consider Muroplama, approved by Anvisa. A 2024 study from the Federal University of Amazonas showed that it improves libido by 25% in men over 65 after 90 days. Another supplement is Tribulus terrestris, which increases testosterone by 18%, according to the Federal University of Minas Gerais, 2024. But, as I always say, consult your doctor before using any supplement, especially if you take medication for blood pressure or diabetes. I've seen patients like Miguel, 72, from Porto Alegre, regain confidence with Muroplama and lifestyle changes. Miguel told me, "Dr. Rossi, my wife and I are experiencing a second honeymoon. The challenges are real. Shame is one of the biggest obstacles. Many men avoid talking about sexual health. With 45 years of experience, I can tell you, seeking help is a sign of courage." Another challenge is motivation. Start slowly, add 1 healthy food per week, walk 15 minutes a day, and gradually increase. If you have hypertension or diabetes, follow your medical treatment rigorously. The Brazilian Society of Cardiology 2025 showed that controlling blood pressure reduces erectile problems by 35%. I want to share the story of Marcos, 73, from Belo Horizonte. He came to my office discouraged, with severe erectile dysfunction and prostate symptoms. We discovered chronic inflammation and high cholesterol. We created a plan: alkaline diet with avocado, kale, and melon, monitored bicarbonate, walks, and kegels. In 6 months, Marcos regained erectile function and reduced his cholesterol medication. He told me, smiling, "Dr. Rossi, I feel like I'm 55 again." Stories like his inspire me to continue. My last advice: have a urological checkup, a PSA test, and a digital rectal exam. Detect prostate problems early. I know the touch scares, but it's quick, painless, and can save your life. The Brazilian Society of Urology recommends this annual exam for men over 55. Don't let shame win. Are you ready to transform your vitality? Leave a yes in the comments if you're going to start this 45-day plan. If this video helped you, subscribe to the channel, activate the bell, and share it with those who need it. Your sexual health is about living longer and better. Let's work together to build a life of energy, confidence, and happiness. Until the next video.